Based on the preliminary findings of our random study, the actual number of infections is potentially 16.5 times the number of those captured through testing sites in local hospitals alone.
A second round of community testing in Miami-Dade County has been completed, and as the results paint a different picture from the number of positive cases at those testing sites. Hello, everyone. I'm Jackie Nesprall.
And I'm Trina Robinson. Thank you so much for joining us. Mayor Carlos Gimenez said more than half of those who tested positive showed no signs.
NBC6 investigator Phil Prazan joins us live from Miami with a look at those results and how they could influence Miami-Dade's phased reopening. Phil.
Well, county and University of Miami researchers now estimate that 165,000 people in the county have or had the virus. They randomly tested about 1,400 people, and 6% of them showed to have antibodies, the biology triggered in your body to fight off the virus once it's in your system. And these initial results did bring up some issues. This was designed to get a better understanding of how many people had the virus but couldn't get tested. County leaders plan to repeat this testing as they open up some public spaces and businesses.
So that as we start to open up the economy, we have to have this kind of testing to see what this virus is doing as we start to open up certain sectors.
150 University of Miami students and staff volunteered with the project. Miami-Dade County lifeguards, not watching the closed beaches, helped administer the test with county fire and medical crews. The first 400 tests were not included, instead looked at as a pilot program to figure out kinks before they tested the other 1,400 people.
It was a feasibility run where we tested our implementation method and got a better appreciation of the logistics of doing community surveillance.
One troubling thing these tests did show, according to Dr. Aaron Kobetz, is African Americans showed to have twice the rate of infection as others. Now they'll look into if those numbers are based on race alone or other societal factors like poverty and access to health care.
COVID has brought to light, I think, the issue of health disparities that are historical and persistent for many infectious and chronic conditions.
The county paid more than $200,000 for these tests. As for the total cost of redirecting some of the staff, Mayor Carlos Gimenez told me it would not be an increase because they were just taking existing responsibilities like those lifeguards we told you about and moving them, reassigning them over to this project. Live in Miami-Dade, Phil Prazan, NBC6 News.
Phil, thanks.